Okay. We're going to start here, Mindy, really soon. So we eat together again, even if no one comes. Where's my, oh, there's Ann. Mackenzie's on. Mackenzie's one of our peeps. Hi, Mackenzie.
Hello.
How are you?
Good. How are you?
Hey, Tyler's just watching his hands and Gabby's running a little bit late, but we'll get started here pretty soon, okay?
Hey, no worries.
And I'm going to give Mindy and Tyler an opportunity to tell about their, you guys need to talk about your charity.
Oh, I was like, my what?
Sorry, your charity. We're playing for charity. Gabby, where are you guys? We're in the main 2300. Okay.
How was the 7 o'clock review?
And they are still on. Jocelyn took that one over and hosted it. So yeah, so they usually end a little bit later than we do. And so yeah, Jocelyn and Casey are kind of running that one. And then
so there were people there?
About 20. About 20.
Good. That's great.
Yeah. We're gonna see if we can win our cohort over. We haven't really pushed our cohort that much yet.
Yeah, well. They might have also, figured out how to study themselves.
Yeah, that's true. Well, we're trying.
Yeah.
Okay.
What format did they use for first semester? Did you do the Jeopardy thing?
No, we've been using just a like a slide deck, and then we have different presenters present different things. And this week, Jocelyn and Casey presented, and I only covered one of the things at the very beginning, and then I got off, and then they took it over. And then next week, it'll be all their group. We've been working to get them to take their own review over. And we only contribute, like Mindy and I only contribute when they ask us to.
So it's Casey and who?
Jocelyn Jones.
Oh, okay. Oh, that's an excellent pair. Nice.
You were just studying preparation for this, or just like?
I mean, just study in general.
Okay.
But I was like, now I don't feel prepared because I feel like I didn't study today.
No, it's fine. All I've done today is the neuro stuff, so I.
Okay, you ready, Tyler? Tyler's just signing on, and when he gets on, we're gonna start.
I made it.
And then when Gabby gets here, we'll get her on, but she's running a little late.
I made it through like 18 slides of the neuro one, but then started like
This is Jeopardy.
So, Chris, we'll see your screen and stuff, right?
Yeah, right now I just have it because I want Tyler and Mindy to be able to contribute, talk to you guys and tell you about their charity and what they're going for, what they're competing for. And then when Gabby gets here, I'll have her do the same. And then once we get to where we're asking questions, Mackenzie will put the questions up like that we were doing in our study group. And then I have all the rationale. So if there's any questions that you're struggling, you don't understand the rationale for, write down the category and the score for it. And I'll bring up the rationale so you can actually see it. So periodically we'll stop and you can ask about the rationales if you want.
Awesome, thanks.
Is that good?
Yep.
You were my guinea pigs to fix all the problems, and now I fixed them.
Don't say that now.
What?
Don't say that too soon.
Last of the big spenders.
Yeah.
Hey, Mindy, do you want to start? So we're gonna do Jeopardy tonight, and while we're waiting for Tyler to sign on, Mindy is gonna come on and tell us about her charity that she's playing for tonight. Mindy, take it away.
Okay, so you'll have to mute. I muted. Okay. I chose NAMI. It's a National Alliance of Mental Illness. My sister and my really good friend are both in mental health. And do you want to turn the volume down while I'm talking? Do you know how to do that? Yeah. We got some feedback in here, guys.
Hold on.
Go to.
I'm in the group.
Is that better?
No.
No.
The podium mic isn't on, is it?
Yeah, I was like, can you just turn the volume down on your computer?
Yeah. Sure.
How's that? Is that better?
There we go.
There we go. Okay, so I actually thought about the Ronald McDonald House, and then Tyler stole it, so I had to choose a new one. But my sister and her friend, they're both really into mental illness, and I actually asked them for some help of what kind of their favorite organizations here are. And my friend actually worked for NAMI. And so it's just like some advocate for like supporting not just like individuals, but families that are going through things. And they have like classes and support groups and systems and different things that, people can go to. They have suicide prevention training. And so I thought it was just a really good organization, especially, while we've been going through COVID to deal with mental illness right now in a world where we all kind of are dealing with a lot. So.
Thanks, Mindy. So Tyler, do you want to tell us about your group, your charity?
Absolutely. Sorry, that took me a second to find the Zoom link. Yeah, so I'm doing Ronald McDonald House. The reason I did that is because that is actually the charity that I have always donated to in the past with philanthropy. I had a lot of stuff in high school I did with fundraising and with just like student organizations. And then when I was in college, I did some more stuff that involved raising money for Ronald McDonald House. So I was like, I'll do it again. I haven't done that in a while. That's basically all I got. I'm ready to win though. Yeah.
Awesome. So we're playing for some good charities. I'll let Gabby talk about hers when she gets here. She's running a little bit late with the traffic. That's not a surprise. And we're going to get started with our Jeopardy.
Oh yeah.
So here we go. So our categories are CM1 exam, CM2 exam 1, CM2 exam 2, cancer and genetics, which is the current one that we're currently on, glucose regulation, which is the current slides that we're on, and then other stuff that doesn't fit into those really well. Okay, so we're gonna go. Tyler, do you want to go ahead and start us off, and we'll start.
Yeah, let's do it. Can I do-
Wait. You have to tell us how to do this. again.
Just push the button on the top. It locks the other person out and lets you answer the question.
So these are synced up. with
They're
each other?
synced up to this computer, and they will lock the other people out. So just
So
one.
I hit the button and then I hit my,
No, just hit the button and just answer the questions. Don't worry about those. Okay.
just making sure that I know what I'm doing.
You just
I
hit.
gotta refresh as well. So I pick the topic and the point value.
Yep.
And whoever pushes the button first, so as soon as the question pops up, we can push the button.
No. I will read the question and all the responses.
And then-
I will unlock it, and then you guys can answer.
Okay, I like that.
Okay.
Okay, I gotta get ready with my button.
So go ahead and pick.
Did anybody
Oh,
see
yeah,
our
glucose
button?
regulation 500.
Glucose regulation for 500. Okay. The nurse is assessing the client's understanding of the use of medications. Which medication may cause a complication with treatment plan of a client with diabetes? Aspirin, steroids, sulfonylureas, angiotensin converting ACE inhibitors. Hit it again. Okay, Tyler, what was it?
Steroids?
Steroids. You're over here, Gabby.
Buzzer's over there.
That is correct, sir.
You're already behind them.
You're okay, Gabby. You're okay. Tyler, you get to pick again.
Oh, no. I'm going to get super competitive. I'm sorry. Oh, I go again?
You go again. You won the board.
Let's do glucose regulation 400.
It's glucose regulation
this
for
glucose
400. Which of the following is not a typical finding in HHNKS? A, blood pH less than 7.35, dehydration, mental status changes, and osmotic diuresis. Mindy,
Oh, I am 3. Is it A?
it is A. Blood pH levels less than 7.35 are not findings in HHNKS. Mindy, you have the board. Gabby, you need to sign in. You need to sign in on your. You need to sign in on your Zoom on your computer.
Oh.
Okay.
Let's do cancer and genetics 300.
Cancer and genetics for 300. Okay, the little thing in the corner that's red. When it turns green, then you can hit your button.
Oh.
We're doing the same thing.
Okay.
A nurse
I thought that was me
cares for a
pushing them.
client who recently completed genetics testing that reveals that she has a BRCA1 gene mutation. Which action should the nurse take next? Select all that apply. Assist the client to make a plan for prevention and risk reduction. Discuss potential risks for other members of her family. Recommend the client complete weekly breast self-examinations. Disclose the information to the medical insurance company.
Going
Tyler.
with A.
Did you read the?
Select all that apply.
Oh.
A is
And
one.
C.
That is incorrect. Mindy,
A, B, and C.
that is also incorrect.
What?
Gabby, if you hit your button, hit your button. Gabby, you can answer if you want.
All of them.
No.
Oh
Okay.
my goodness.
I don't get which one.
Wait, yeah, can we push the button again?
No. Mindy, stop hitting the button.
Did I lose points?
Okay, the correct answer was make a plan of care and discuss the family risks. The other two, recommend a client completing for weekly breast exams isn't appropriate.
Okay.
And then disclosing the information with the medical insurance company, that's a violation of their HIPAA.
Why is
So
the breast
it's
exam not
inappropriate because we're
Because
not a
breast
provider?
exams are only appropriate 7 to 10 days after ovulation when the hormones are right.
Okay,
So you can't do it weekly and get a good response.
Oh, wow, I didn't know that.
Okay, Mindy, you still have control of the board.
Let's
Wow.
do cancer and genetics for 400.
Cancer and genetics for
I don't know the
400.
cancers.
What are y'all logging in on?
There's a Zoom link on. I
The
had to,
nurse
like,
is
send it from
developing an
Google.
educational program about prostate cancer. Gabby, just go to the
I can text you the link.
and go to the website, or the website for education committee, and the link is on the website on the ticker at the top. A nurse is developing an educational program about prostate cancer. The nurse should provide information about which topic. The prostate specific antigen test is reliable for detecting the presence of prostate cancer. For all men, the age 50 and older, the American Cancer Society recommends an annual rectal examination. C, not lifting more than 20 pounds aids in prevention of prostate cancer. And D, regular sexual activity promotes health of the prostate gland to prevent cancer. Tyler,
A.
that is incorrect.
I'm terrible at this.
Mindy,
Is it B?
that is correct. All men
Nice.
age 50 and older are
It's
recommended by the
yearly?
American Cancer
I didn't know
Association.
that.
There's a bunch of links on here, and
Don't-
the only one that I've clicked on takes me to YouTube. So
Here, yeah, pause real quick. I'm gonna send her the
Okay.
link for the Zoom. Because I just had it pulled
You
up.
can still hit your button right now, though.
You can
Ooh,
still,
me?
juggling too many.
Yeah, just hang on,
You're okay,
hang on.
Gabby. Hey, Gabby, take a deep breath. It's gonna be okay.
I'm fine. I'm just saying I'm not a magician.
I never would guess.
Let me
It's
see.
like the game of the heat is kind
I'm
of
good.
firing now.
Besides traffic.
Oh, you know.
Okay, I just sent it.
Sorry, guys.
Okay.
Okay, Gabby,
don't
we're
think
gonna
you need
keep
a
going.
password
Just
or
get on when you can. It's gonna be fine.
Okay.
Okay,
Okay, should
Mindy,
be
you
good.
you're still have the board.
Cancer and genetics
Ugh.
for 500.
Cancer and genetics for 500. When teaching a client about ovarian cancer, the nurse should include which information, select all that apply. Details about prognosis, staging and grading of ovarian cancer, procedures for diagnosis if there is a pelvic mass, need for routine colonoscopy beginning at age 30. Tyler,
ABC. Come on.
that is incorrect.
Oh
Mindy,
my gosh.
B and C.
that is also incorrect.
What?
Do I get to go?
Yeah, you can push your button.
I just did.
There you go, Gabby.
Okay.
Negative 700 points.
B and D.
Oh my god.
That's incorrect. The correct two answers were staging and grading of ovarian cancer, and C, procedures for diagnosis if there is a pelvic mass.
But nothing about prognosis.
Nope. The
Is that just 'cause we're not
prognosis is by the
providers?
doctor.
Yeah, we're not providers.
What did
Okay.
you say the answers were?
The answers was B and D, staging and grading of ovarian cancer, procedures for diagnosis if there is a pelvic mass.
B and C.
B and C.
B and C.
That's what I said.
You did? I thought you
That's
said
what
B,
I
C,
said.
and D.
I don't remember. Don't look at me.
That's what I said.
I wasn't paying attention.
Judges?
Excuse me.
Okay.
This happens too many times.
I think that's you, Chris. You're the
So
judge.
probably Mindy's right.
I'm the judge.
There's no one else. In
I
the
said B and
Give her the
C.
points.
It was 300.
Is that not?
I didn't mean to hit my button.
That's what I just
There
clicked
you go,
on.
Mindy. Okay, you still got the board.
I don't know. It's
Have it on Zoom?
it's
No.
probably fine.
We just can't hear you is all. There
If
you
you
go,
just speak
Mindy.
up loud, they'll hear you through my mic.
Cancer and genetics 200.
Okay.
You found like the weak spot.
Which precaution is most important for the nurse to teach a client receiving radiation therapy for head and neck cancer? A, avoid eating red meat during treatment. B, your leisure activities to prevent fatigue. C, see your dentist twice yearly for the rest of your life. D, avoid using headphones or headsets during until your hair grows back. Mindy,
B.
that is incorrect. Tyler,
D,
D as in
dog.
that's also incorrect.
Oh my
Gabby?
God.
C is correct. You need to see your dentist twice
Why?
yearly for the rest of your life because radiation affects not only your lymph nodes, but any metal in your mouth will get radiation.
Oh.
Good job, Gabby. You have control of the board.
She showed up late and she's already, what, 1,000 points ahead of me?
No, she's not.
1,200 points ahead of me.
60.
I thought I was at 300.
I thought she's at 300.
No, we're the wrong way, guys.
Oh.
He did 1, 2, 3.
Wait, now you have 300.
I'm 300.
There we go. Whatever. We'll figure it out.
Now we have to- Okay.
Okay, hold on, Gabby. You have 200 points. There you go. Okay, you're up.
Wow, I'm doing great.
She get 200.
Glucose regulation, 300.
When teaching the diabetic client about foot care, the nurse should instruct the client to A, avoid going barefoot, B, buying shoes a half size larger, C, cut toenails at angles, and D, use heating pads for sore feet. Gabby,
Going barefoot.
that is correct.
Okay, glucose regulation, 200.
Okay, glucose regulation for 200. A client with type 1 diabetes mellitus has diabetic ketoacidosis. Which finding has the greatest effect on fluid loss? A, hypotension, B, decreased serum potassium level, C, rapid deep respirations, or D, warm dry skin. Tyler,
Hypotension? I don't really, yeah.
what did you say?
Hypotension?
How
That-
many of these connect?
Is incorrect.
Yeah, I was confused too.
Mindy, that is also incorrect. It is not B.
D.
D, warm dry skin.
Yeah.
That's not correct.
Why
Correct.
would respiration have any effect on?
Because
Blowing
what is
water
rapid deep respirations called in diabetic ketoacidosis?
Kussmaul respiration?
Kussmaul respirations.
What does that have to do with
That
fluid
answers
loss
not the
though?
question. How
It,
does that-
it,
I
it
think
because of
it's
vapor
because yeah, they
vapor loss.
respirate
It's called
too
vapor
much.
loss. The
Yeah.
rapid breathing, you're losing water through air through vapor in your breath, and it's a way that your
Huh.
body tries to compensate for DKA. I have the rationale, Tyler. We'll look it over.
All right.
That's interesting.
Okay, you still have the board, Gabby?
I do.
Yep, you do.
Oh, okay. CM2 exam 1, 300.
CM2 exam 1 for 300. The nurse is assessing a client with dark skin for the presence of a stage 1 pressure ulcer. The nurse should use a fluorescent light to assess the skin. B, inspect the skin only when the Braden score is above 12. C, look for skin color that is darker than the surrounding tissue. And D, avoid touching the skin during inspection. Mindy,
It was working, guys. C.
that is correct. Look for skin color that is darker than the surrounding tissue. Good job. You have the board, Mindy.
CM2 exam 1, 400.
CM2 exam 1 for 400. An older adult is admitted with a fracture of the femur. The nurse should first assess the ability to change position, type of pain, mechanism of injury, extent of anxiety. Tyler,
Mechanism of injury.
that is correct. Tyler, good job. You have the
I
board.
just need to get away from the cancer genetics and the weird fluid question.
Cancer and genetics for
I
100.
want to do CM2 exam 2 500.
It's a daily double, Tyler.
Ooh.
You can bet anything you want. I won't restrict you.
What do I bet?
You are negative 700 right now, and
So
just
whatever you bet, if you get the correct answer,
700.
okay.
there you go.
Get me back on the board.
Dang you. That's what happens when you try to be smarter than the screen. Come on, you. There we go.
So this is just for him.
This is
right?
just for him. Yep.
Oh, only I answered it?
Only you answered.
So I have a
those.
second to answer that.
Say, so TPN is prescribed for a client who has recently had a small or large bowel resection and who is currently not taking anything by mouth. The nurse should administer TPN through a nasogastric or gastronomy tube, handle TPN using strict aseptic technique, C, auscultate for the presence of bowel sounds prior to administering TPN, D, designate a peripheral intravenous or IV site for TPN administration. Five seconds, Tyler.
5 seconds?
Yep.
You don't get all the time in the world.
Okay, answer.
C.
C is incorrect. The correct answer was TPN using strict aseptic technique.
It's aseptic.
Yep. That's correct. Yeah, Tyler, you still up the board. Oh, it gave you the points. Why did I give you the points?
Yeah, wait, I didn't get the points. I have negative 1,400
Yeah, I
now.
was gonna say, there we go. Okay, Tyler, keep going. You got the board.
I get to go in?
Yep.
Oh, we did 400. I want CM2, exam 2, 400. Yeah.
A client has had a stasis ulcer of the left ankle with +2 pitting edema for 2 years. The client is taking chlorothiazide. The desired outcome of this drug for this client is A, improved capillary circulation, B, decreased blood pressure, C, wound healing, D, absence of infection. Tyler,
Decreased blood pressure?
that is incorrect. Mindy,
It's A.
improved capillary circulation is correct.
So chlorothiazide, it's a secondary most of the time as a blood pressure. First is.
Okay, so let's take a quick commercial break here and ask anybody online or here, were there any questions that we've gone over
Why would
that
that
you'd
make
like to
capillaries work better?
see
Yeah,
rationale for?
why would that do anything with the capillaries?
The capillaries is for the fluid loss, right?
But he was talking about it in the context of like pressure ulcers.
But I think it was talking about two plus pitting edema is what I read. And so 2 plus pitting edema mean I need to get rid of fluid loss.
How would that increase capillary?
Doesn't that increase, like, when you increase capillary reef or whatever?
Yeah,
We'll
I
find
mean,
that one.
Can we go back to that question, Chris?
yeah, Chris.
That one for us?
That was CM2 exam 2 for 400.
Yeah.
Yeah, let's actually go see it.
Oh, hey, you're on, Gabby.
Yeah, I finally got it.
So show us the,
An older adult is a miss. Oh no, is that right?
It's exam 2, sorry.
Oh,
Exam 2,
There we go.
400.
There it is. Okay. So this is the client. The rationale, the result of chronic venous stasis is swelling and edema and superficial varicose veins. Diuretics will help reduce the swelling, thus improve capillary circulation. Although diuretics may decrease blood pressure, that is not the intended outcome of this drug. The nurse should teach the client to prevent infection and monitor wound healing, but these are not the primary outcomes of chlorothiazide.
I just didn't even know that chlorothiazide was used for ulcers.
Capillary
It's
circulation?
not for ulcers. That's not the, I don't think that's the point of the question. Like that's like a question or something thrown into the question. That it's talking about left ankle with 2 plus pitting edema, and the ulcer part of it doesn't matter technically for the question of.
They're using chlorothiazide in this instance to reduce the swelling, not affect blood pressure. It's not fluid
And with the
overload.
ulcers,
But like,
That wasn't the answer, though. The answer was not reduce
it was
swelling.
improved circulation. That's what I'm
and
confused
improving
about.
circulation. So they're improving circulation at that site by relieving getting all that fluid out of there. Getting the edema down really improves the circulation so that the immune system and everything can get in there to do its job.
All right.
Sorry, that's
gonna
why
fail
I
the
got the
NCLEX.
rationales, because I wanted to be able to give you
No,
the right
it's,
rationale.
yeah, I guess. I don't
Based
know.
on the answers that were present, improving capillary refill was the best answer. that
Okay.
was there. It was
Got
the
it.
right of the right of the right orange. It was the most orange of the oranges.
Makes sense. Yep.
Because
Yeah.
blood pressure is yes, but because there was nothing about blood pressure in the question, I went to my swelling and edema.
Okay, Mindy, you're up.
I don't think I technically knew that I did like a process elimination where I was like, okay, it's not blood pressure, it has nothing to do with the ulcer or infection.
It is blood pressure though. That's what I'm confused about. Is we're alleviating the
Yeah,
fluid overload.
Yeah, changing blood pressure would decrease swelling.
But technically chlorothiazide is a diuretic, not, I mean, the secondary is hypertension, right?
What do you mean the secondary? It decreases reabsorption of sodium. So it's going to get rid of water.
What's going with it when you pee?
The water, so it decreases your blood pressure. That's what I'm saying. That's
So
why
then
I'm
you're
like,
not pushing more
I
water
would think it
into
would
the swelling
decrease
area.
circulation.
You're just removing water from the system, which is going to make the swelling in that place go down.
Exactly. That would be the decreased blood pressure answer.
Okay, I'm telling you that is what's happening. I'll let Ann answer that one for you guys.
I need to stand up for the rest of these.
Mindy, you got the board.
I don't have enough blood pumping.
Sorry,
Oh,
Tyler.
it's okay.
CM2, exam 2.
Hey, Chris, real quick, can you say what you said about the cycles and the breast exam on that BRCA1?
You want to see the bracket 1 exit question?
I don't remember what you said about the cycles, why you wouldn't
Sure.
perform a breast examination.
Let me bring up the
You
guys have already answered all these.
made this really difficult.
Sorry, Tyler.
No, it's
Sorry,
okay.
here it is. So,
Oh, you mean the questions are really
Mackenzie,
hard?
the question was: a
Yes.
nurse cares for a client who recently completed genetic testing that released testing. I can't see it myself. My eyes are bad. That revealed that she has the BRCA1 gene mutation. Which action should the nurse take next? Select all that apply. Okay, the original question had like 6 things in it, but I can only add 4. But the correct answers are A, B, and E, and the rationale is this. The medical surgical nurse can assess the client's response to the test results, discuss potential risks of other family members, encourage genetic counseling, and assist the client to make a plan for prevention, risk reduction, and early detection. For some positive genetic test results, such as having BRCA1 gene mutation, the risk for developing breast cancer is high, but is not a certainty. Because the risk is high, the client should have a plan for prevention and risk reduction. One form of prevention is early detection. Breast examinations may be helpful when performed monthly, but those performed every week may not be useful, especially around the time of menses. A client who tests positive for BRCA1 mutation should have a test at least yearly, mammograms and ovarian ultrasounds to detect cancer at an early stage when it is more easily cured.
That makes sense. Thank you.
Okay, no problem. That's why I got the rationales for everybody so we could stay on board.
Extend all of those rationales.
I'm going to make sure the rationales are published for all
And
of
I'll
you.
talk about that same question
Okay.
later.
You guys
I
ready
would
to keep
love
going? Mindy, you got the
CM2,
board?
Yes.
CM2, exam 2, 300.
I'm doing really well.
Tyler, you're doing great, man. When assessing a client for early septic shock, the nurse should assess the client for which finding? A, cool, clammy skin. B, warm, flush skin. C, increased blood pressure. D, hemorrhage. Tyler,
B.
B,
Which one?
warm, flush skin.
Yes.
That is correct, Tyler. Good job. You got the board.
This like sport mode is coming out. I'm gonna push this as quickly as possible. I'm scared of exam 2 stuff now because I don't know things about ulcer. Let's go with other stuff 400.
For what?
Other stuff 400.
Fucking surprise.
Client Z is admitted to the hospital and is very scared of an upcoming surgery. He begins to hyperventilate and becomes very dizzy. Stat ABGs reveal a pH of 7.61, a PaCO2 of 22 milligrams of mercury, and an HCO3 of 25 milliequivalents per liter. What is the ABG interpretation based on these findings? Tyler.
Uncompensated respiratory alkalosis.
That is correct. Good job.
I cannot do ABG stuff in my head.
Yeah. It's okay.
I love those.
I can't click
Tyler,
the
you have
button
the
very
board.
fast.
I didn't
500
even
other
try.
stuff.
500 for the other stuff.
I didn't
Okay, Anne, who is drinking beer at a party, falls and hits her head on the ground. Her friend Lisa dials 911 because Anne is unconscious with depressed ventilations, shallow and slow respirations, rapid heart rate, and is profusely bleeding from both ears. Which, I don't know why it just says which metabolic condition would she be in? Metabolic acidosis, metabolic acidosis, respiratory acidosis, or respiratory alkalosis? Tyler.
Mine's broken.
Respiratory acidosis.
It is respiratory acidosis.
I'm coming back right now,
Can
guys.
job.
we go over that one real fast?
So if the patient is not breathing,
Not breathing.
hit their head, what are they going to be holding on to?
Oh, CO2.
There we go.
Fantastic.
There we go. You got it.
Can't think fast enough. Tyler just jumps in there.
Yeah,
I have to get my points back.
Now, it's so funny.
My buzzer's not working.
It's working.
Hard,
He checked it.
Gabby.
We checked
I'm
it.
like
I am
ready
hitting
for
it
the
hard.
grid.
Tyler, you have the board.
300 other stuff. I'm taking this whole column.
Ricky's grandmother
All ABG.
has been suffering from persistent vomiting for 2 days now. She reports Malaysia. Measurement of her arterial blood gas shows a pH of 7.5, PaO2 of 85 milligrams of mercury, PaCO2 of 40 milligrams of mercury, and HCO3 of 34 millimoles per liter. What acid-base disorder is shown? Respiratory acidosis compensated, metabolic alkalosis uncompensated, metabolic alkalosis partially compensated, and respiratory alkalosis uncompensated.
Mindy.
Wait, isn't that
Mindy.
Mindy?
Mindy.
No.
Mindy is number 3.
What? I thought you switched it.
Mindy, you're number
He
3.
switched it and then he switched it right back.
He switched
right
it back? Okay.
Yep.
You know what?
Like I should have just stayed in traffic.
It is uncompensated metabolic alkalosis.
That is correct.
Nice.
Good job, Mindy.
1100.
Yeah, I've been kicking butt, okay?
Oh my god.
This game is rigged.
Hold on. Let's take a break for a second. Gabby, push your button. Your button works. I just checked it.
But it doesn't light up on there.
No,
No,
I
it's
just
not
checked
lighting
it
up
on
right
my
now.
computer when you press, and it came up, so I know it's working. We're all still friends. Mindy, you have the
We're all
board.
Still friends. I'm eating banana crisps.
Those are
Cancer
good.
and genetics 100.
Want some?
Cancer and genetics for
Oh.
100, and the final one in this category. A patient who has underwent a bone marrow transplant is at most risk for what? Bleeding and infection, congestive heart failure, liver failure, or HIV. Tyler,
Bleeding and infection.
what did you say, Tyler?
Bleeding and infection.
That is correct. Good job. You have the board.
Other stuff 200.
Other stuff for 200. The physician orders an IV with heparin at 700 units per hour.
God.
You have a bag with 100 units per milliliter of solution. How many milliliters per hour will you set the IV infusion controller?
It's not working.
Gabby, press it slow. There you go.
Oh my gosh. 7
7 what?
milliliters an hour.
Perfect. Good job, Gabby.
Oh, I didn't even read the question.
Excellent.
Whatever. I can't do math in my head.
Good job, Gabby. You have the board.
Thank you. Can we all agree that this hasn't been working?
Just don't slam
Yeah,
it
you
like
can't-
Tyler.
Gotta
And
be
you
more
gotta
gentle.
hit it like once and like hold it down hard. I think.
There you go. Okay, who's
All
got
right.
you got the board, Gabby?
Okay. CM2
Definitely
exam
not
1,
the button.
500.
CM2 exam 1 for 500. A female client with which condition would be at risk for increased severity of vagal, vaginal, candidiasis? Select all that apply. Immunosuppression due to cancer, HIV infection, hypertension, or asthma. Tyler,
I have no idea. Immunosuppression due to cancer,
okay?
HIV infection, and asthma.
That is wrong. Incorrect.
Oh, it's just, I know what it is. Never mind.
Mindy.
Sam.
It's just A and B.
No, it's not. I know it isn't.
A and B,
Yes.
that's correct.
Oh, I'm just dumb. Never mind. You don't have asthma. Yeah. Asthma's in your mouth. Not,
Sorry.
Yeah.
Tyler figured out.
I forgot anatomy.
Tyler figured out his own rationale.
Second guy, he's fine.
You have the board,
This is why I
Mindy.
said I
in your
take the
mouth?
full 2
Mindy.
hours for my exam.
Mindy, you have the
I
board.
do not think quick.
Let's do CM CM2 exam 1, 200.
CM2 exam 1 for 200.
Yes.
The nurse is caring for a client who just returned from having a PCI with angioplasty with femoral arterial access. In which order, from first to last, should the nurse obtain information about the client? All options must be used, and they must be put from first to last when you would do them. Vital signs and oxygen saturation, pedal pulses, color and sensation of extremity, and catheterization site.
All right, so we're gonna go with, it's simple. You gotta do airway, breathing, circulation. When you say vital signs, are you putting more emphasis on the idea of vital signs or oxygen?
You just need to put them in the order that you would do them in, and I'll tell you if it's right.
Stop cheating.
This is a trick question. Oxygen saturation is first,
Okay.
then pedal pulses, then catheterization site. I don't know which one would be first though, because they both have to do with circulate. No, I'm gonna do A, D, B, C. Final answer.
That is incorrect.
Well, shoot.
Mindy,
A, B, C, D.
A, B, C, D. That's incorrect.
I got it. I
Okay,
got it.
Gabby,
ABDC.
that is correct.
Oh my god.
Gabby, you have the board.
Okay.
Gabby's trying to.
Damn, so I switched it last. You shouldn't
You
change your
switched
answer
it, and you
last
shouldn't
second.
have, because you were right. You were right, Tyler. Gabby,
Okay. CM1 exams 400.
CM1, which CM1 400?
Yeah.
Mission cardiac.
In which
Oh,
of
God.
which of the responsibilities related to the care of a client with a Foley catheter are appropriate for the nurse to delegate to the unlicensed assistive professional? Select all that apply. Flush the catheter as needed to ensure patency. Empty drainage bag and record output at specific times. Perform bladder irrigation as prescribed. And D, provide Foley catheterization and peritoneal care each shift. Mindy,
B and D.
empty the drainage bag and provide Foley care. That is correct, Mindy. Good job.
Nice.
No?
That's correct. You got it.
Wait, did it say record the drainage?
Empty drainage
Do you
bag
have a
and
question
record
like
it.
that in foundations where we weren't supposed to?
Your
do that?
unlicensed professional has been doing that. I guarantee your clinic.
Oh, I was doing that too, but
Yeah,
didn't
like your
I
CNA
swear that
your
was like a thing we
CNAs
talked
can do-
about.
I mean, yeah, CNAs.
That
can
like
do
the nurse has to record the. All right.
the only cares that they cannot do are assess and diagnose. Everything else they can do. They can do vital signs. They
Yeah,
can.
so if
they
they can
can-
do vital signs, you can keep track of.
But they
like-
can't flush the line, can they?
No, they cannot. That's
Yeah,
part of
they
ours.
can't flush a line.
Yeah.
Cool.
Okay. Mindy, you have the board. Banging on that thing.
I try.
Exam 1.
CM2 exam 1 for 100. For last of the category. The client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? A, serum potassium as at 3.5 milliequivalents per liter. Blood pressure is 88 over 48 milligrams of mercury. ST elevation is present on the EKG, and the heart rate is 61 beats per minute. Gabby,
B, the blood pressure.
you are correct. Good job, Gabby.
Thank you. Okay. CM1 exams 500.
CM1 exam for 500. About 1/2 hour before the daily whirlpool bath and dressing change, the nurse should soak the dressing, remove the dressing, administer an analgesic, and then slit the dressing with blunt scissors. Tyler. 3,
Remove it.
remove the dressing.
I don't even.
That's
yeah.
incorrect. Gabby,
I don't know what this question is.
Administer an analgesic.
administer an analgesic is correct.
What is a whirlpool? What did it say? I can't even process what
I
this is.
immediately
basically a
envisioned a
wound- it was a
toilet
wound-
flushing.
I don't.
It was a wound care answer. It was
Yes.
about wound care
So
Right.
before you do the dressing, you want to administer the analgesic.
because it's going to hurt.
Because it's gonna hurt when you're
Take it
irrigating
off.
the wound.
What was the whirlpool?
The whirlpool thing was just to throw you off.
It did. It worked.
And that was why it was a 500-point question.
I have literally been doing clinical management since 8 a.m. today. I have no CM energy left, so I'm trying.
You're okay. You're doing great,
Clinical
Tyler.
management.
Gabby, you have the board.
Okay, CM1 exams 300.
CM1 exams.
Gabby's trying to
Gabby, you have a daily double. What do you want to wager?
400.
You should do 1800.
Okay, Gabby, you're the only one who can answer this one.
Okay.
The nurse teaches the client how to instill nose drops. Which technique is correct? The client uses sterile technique when handling the dropper. The client blows the nose gently before instilling the drops. The client uses a new dropper for each installation. The client sits in a semi-Fowler's position for 2 minutes. What's the correct answer?
B.
The client blows the nose gently before instilling the drops is correct. Good job. You have control of the board.
Every time I have to answer a question, I get it wrong. But anytime anyone else does, I think it, and I'm like, no, that's going to be wrong because I thought that, and then it's right.
CM1 exams
Nonsense.
200.
CM1 exams for 200. The nurse is preparing to teach a client with iron deficiency anemia about the diet to follow after discharge. Which food should be included in the diet? Eggs, lettuce, citrus fruits, cheese. Tyler.
Lettuce.
That is incorrect.
Oh my god.
Ooh.
Oh.
Wait. What?
Iron.
You gotta hit your buzzer.
Cheese.
That's incorrect, Gabby.
Dang it.
That's what I was going to do
Mindy,
next.
you want to take a stab at it?
There's only one thing it could be.
C?
That is
I was
incorrect.
gonna go with
The
eggs.
correct answer was eggs.
Kale has iron. I'm not crazy, right?
Kale has iron.
Yeah.
Dark leafy greens. I guess
Dark
lettuce
leafy
is a
greens.
dark.
The best answer of the oranges, the
Oh.
most orange was eggs. Eggs has the most iron out of the.
I think lettuce isn't a dark leafy.
Yeah.
Gabby, you still have control of the board.
Ha, okay, CM2 exam 200.
What is the most important goal of nursing care for a client who is in shock? Manage fluid overload, manage increased cardiac output, manage inadequate tissue perfusion, manage vasoconstriction of vascular bed. Gabby,
Manage inadequate tissue perfusion.
that is correct. Good job. You still have control of the board. What are we going to next?
OTE.
That's not a category.
CM1 exams 100.
CM1 exams for 100. Okay. A sedentary, obese, middle-aged client is recovering from surgery to remove an embolus in the right iliac artery. The nurse should develop a discharge plan with the client that will focus on participating in which activity. Select all that apply. Aerobic training, stress management, weight control, and strength training. Mindy.
Weight control, strength training. ACD.
That is incorrect. Tyler.
ABC.
What was it?
ABC.
That is also incorrect.
Oh my god.
Gabby.
All of them.
That's incorrect.
Yeah, for heaven's
The
sake.
correct answer is aerobic training and weight control. Those are the only two that they recommend. Yep. Stress management's not going to do anything for a DVT, and weight training, although good for them, is not going to doesn't actually help them with a DVT.
Okay.
But doesn't that strengthen the muscles and like squish blood up?
Aerobic
What are you
training
talking
is better to keep their blood moving.
Then
Weight training is
It
good
keeps
for
me
them,
as
but it
returned.
is not a primary method to control DVTs. Okay,
Oh.
Gabby, you have control of the board.
Okay, glucose regulation 100.
Glucose regulation for 100. A client has developed diabetic ketoacidosis. The nurse knows that this is a complication of what type of diabetes? Mindy, that is incorrect. Tyler,
Oh!
Tyler.
Type 3. I'm
Type-
just kidding. Type 1.
Oh, I'm like, type
I was
what?
like, yeah, give me
That
the
is
point.
correct. Type 1 diabetes that's a major complication of DKA is a major complication of that diabetes. Tyler, you got control of the board.
Other stuff.
Other stuff for 100.
No.
Physician orders alprazolam Xanax 0.5 milligrams PO. You have on hand Xanax 0.25 milligram tablets. How many tablets will you give?
Stop.
Mindy,
You-
Come on.
What?
2 tablets is correct. Mindy,
Oh,
good job.
yeah.
someone was like, no, it's too
Okay,
late.
the last thing in the category is CM2 exam 2.
Yeah, one.
Okay, a client diagnosed with peptic ulcer disease or PUD has H. pylori infection. The client is following a 2-week drug regimen that includes clarithromycin along with omeprazole and amoxicillin. The nurse should instruct the client to alternate the use of the drugs, take the drugs at different times during the day, discontinue all drugs if nausea occurs, and take the drug for the entire 2-week period. Gabby.
Take the drug for the entire 2-week period.
That is correct. Good job. Okay, Final Jeopardy. Here we go. Final
no.
Jeopardy is famous nurses.
Oh, no.
What do you want to bid? So on your paper, you'll write down your bid on your Final Jeopardy paper. There's a Final Jeopardy so you can see the
For
questions
famous
and write everything
nurses?
down.
Okay.
So go ahead and write down your wagers. Gabby's currently in the lead.
Wait, how does this work?
You write your wager, what you want to bid on Final Jeopardy. I'll give you the question. You'll
How many
answer
points
it.
am I out? Okay,
You're
I'm
out.
going with 2.
You need
How many do I need to get
a
caught up?
lot.
You
I'm
would
putting
need to beat,
4,000
if Gabby
down.
bets everything.
Yeah, you need about.
4,000. That's my.
Okay,
wager.
there you go.
I'm writing with my.
So when
left
you're
hand,
ready,
it's
just
gonna
put it
look
up by your
horrible.
little name tag so I can see it. So I know you're all ready, and I'll put them in, and then we'll go on to the
My
question.
hands are all
Well,
greasy.
except I don't want to see your answer though.
Oh.
So you're gonna have to do yours.
You guys are awesome.
I don't want to be rude and know what your answer is. So.
Oh, so we're guessing who the nurse will be.
Well, no, he's gonna put up the question, and we're just gonna write it down.
Oh, just so that you know, Jocelyn Jones says this is primetime entertainment, and she also put for the question, eggs. Okay, you guys got your wagers? Put them up. You need to see them.
Oh.
Gabby, what are you bidding?
1,700.
Gabby's going all in. Tyler, what are you bidding?
4,000.
4,000.
No,
Mindy,
make it 5,000.
what?
I paid 500.
Mindy's in for 500.
I'm not gonna know. Who
Okay.
this is.
Y'all ready?
I
Here's
don't
the
know
question. During the Crimean War, this famous nurse was put in charge of the hospital in Scutari, and her actions within 6 months reduced the mortality rate from 42% to 42% to 2%.
There's no A through B or D.
No,
Nope, you have to know the
write
person by name.
I know.
That's why you're gonna write it on your card, so you can't cheat.
Can I keep this pencil?
Yeah, you can keep it if you want.
Okay. I only ask because my hands are greasy and I don't want to touch it and
You
then
can
give
just
it back
keep
to
it,
you.
it's fine.
Banana grease.
Banana grease.
Gross.
Okay, 15 more seconds, and I'm gonna move on.
There's more?
No, this is Final Jeopardy, and we're done.
Oh, okay, okay.
I'm saying we're gonna move on and get the answer and finish the game.
I got it right. I know.
I'm pretty sure I got it right too.
Gabby, you done?
Yep.
Tyler? Tyler?
Oh, I'm ready. I put mine down already.
Mindy, we're moving on. Who is Florence Nightingale? Put up your thing. Did you get it, Gabby?
Yeah. Yep.
Gabby got it.
We all got it.
Tyler got it. And Mindy got it.
That means I lose.
Good
That means I just-
job.
I'm no longer negative?
Nope, you're no longer
You're
negative.
no longer negative.
That's all I could have asked.
The winner is Gabby.
That's incredible.
So Gabby, who were you playing for? And tell the
Oh yeah.
Make
I
sure
was-
you're not muted if you're gonna tell them.
I'm not muted.
Oh, okay. I was muted that whole time. I realized, guys.
You're okay. Gabby, go ahead and tell the group about your
The
Charity.
charity. Yeah, so it's called Direct Relief. It's a super cool charity. They will like donate medical supplies for people like all over the world, and basically just try to bring better healthcare to places in like third world countries or just places that need it. So
good job, Gabby. And you won, so you're going to get a $25 to donate to that group in your name, and that's
Cool.
awesome.
sweet.
Good job. Okay, that is the review for today
Sweet.
for group number 2, and
Sweet.
that's going to go in the history books, and we may do this again.
Thank you guys. It was so fun.
Thanks, Kay, Jocelyn. Who else was on here? Mackenzie. Mackenzie,
okay,
did you have fun?
That was fun
That was
watching
great.
you guys argue.
Mackenzie's like, that was awesome. Mackenzie, we know you too well to know that you're not being entirely honest.
No, I was laughing because Tyler, you're like me. I'm always end up in the negative because I try to do every question, even if I know.
Yeah,
they're-
she tries to answer every question. She's like, I'm always in the negative too.